I often I often do think that it's also a form of denial that family members struggle with. So my loved one is now in treatment. When I'm speaking to them, they're sounding so much better. They're making a lot more sense over the phone. Um, they're sounding a bit more remorseful. When I'm having the conjoint with them, so when I'm seeing them, whether it be on a WhatsApp call or on a Zoom call, they're starting to get some color in their face. They've picked up a little bit of weight. So they're physically starting to look better. And then it's so easy to forget. It's so
Yeah.
easy to say, okay, no, they're looking better, they're sounding better, they must be better. And then we have this, they must be healed. And I think we need to
Yeah.
be very, very careful to slip into that trap. We need to
Mm.
remember that this takes time. It takes time.
And I think much like the NA and AA 12-step programs, family support groups are very similar.
Mm.
I think our experience, those of us that have lived through it, can tell you that part of me wants to believe it's going to be sorted in 24 days. When
Absolutely.
I got offered a 12-month program, I jumped for joy for my loved one because I knew that gave more than a 30% chance of a sustainable recovery. I couldn't do more of the in rehab, relapse, out, in, out, in, out. From an emotional point of view, an energy point of view, and a financial point of view, we can't do it.
Mm.
So I often say to people, if you have the option, and it doesn't always have to be a changes, any option you get offered of long-term treatment anywhere, jump at it because
Absolutely.
you're giving them a substantial opportunity to consolidate what they've learned in the first 3 weeks and take it into a long-term sobriety or recovery.
Mm. Yeah, I agree with you. We would obviously recommend changes because we believe in what we do. So absolutely, that would be our first recommendation. But we acknowledge that there are many other treatment centers that are also really good. And we also know that their personal circumstances, their financial circumstances, there are a lot of things to consider when making these decisions. So the team is really open to having those conversations and to making the necessary recommendations. So as Cheryl said, if there's the possibility and opportunity for longer treatment, even if it's not with changes,
Mm,
absolutely take that opportunity.
mm.
Absolutely.
Okay, so number 4, effective treatment attends to the multiple needs of the individual, not just his or her drug abuse. And I think we've kind of touched on that, right? So it's this disease, the addiction, it hasn't just taken 21 or 24 days to develop. It's been there for a substantial amount of time. And with that, it's not just the drugs that we need to deal with. You know, getting your loved one substance free, that happens pretty early on. Once they enter the primary care treatment, they go into a detox regime, they detoxed, and soon thereafter they're substance free. But it's the behaviors, it's the beliefs, it's the emotions, it's the trauma that's been caused with the addiction that needs to be worked through. When your loved one is in primary care, we need to start dismantling the denial, and we're going to have a look at that a little bit later. We need to work on relationships. We need to work on communication. We need to work on boundaries and codependency. We need to work on shame and guilt. We need to work on anger and anger management, communication. We need to work on toxic relationships. We need to work on various emotions and how to regulate emotions. We need to work on coping skills, cognitive distortions, relapse prevention, the relapse stages, triggers, warning signs, character defects. So those are just some of the things that need to be addressed. So just some of those that I've just listed, 21 or 24 days is simply not enough to address that. So we can perhaps start the education process, but there's not enough time to start implementing that. And for your loved one to start implementing it and seeing, okay, well, I've learned about communication, but I've just had a phone call with my mom, and that didn't go down too well. or, you know, I'm trying to put boundaries down and I'm really struggling, or I'm pushing boundaries. So it's also about implementing it, and it's about learning from your mistakes and to keep implementing those things. So yeah, recovery is definitely quite a long and lengthy process, and I think it's just important to keep that in mind. Number 5, an individual's treatment plan must be assessed continually and modified as necessary to ensure that it meets his or her changing needs. So a little bit of inside info in terms of how we work at Changes. We have a case management meeting for each phase of treatment once a week, and the team meets and we discuss each one of your loved ones. We discuss current struggles, progress, concerns, prognosis, what needs to happen in therapy sessions. We give JFTs. The Dr. Tia and Dr. Mashadi sit in on those case management sessions. We get their input and opinion. So at least once a week, we have a very comprehensive case management meeting. But apart from that, we're constantly discussing your loved ones. We work quite closely together as a multidisciplinary team. So if I've just had a session with somebody and I feel that something concerning has come up and I feel that I need the team's input, it's something that I would process with the team. I'd get the team's input. You know, we'd contact the families if we feel the need to. So there's constant evaluation of your loved one, and constant evaluation of what their needs are in the here and now, but also going forward. So from very early on, we start the discussions and start considering, you know, what is the possible way forward for this particular person. We know we need to take individual circumstances into consideration. So often one does need to return to work, therefore they can't continue with secondary care. Again, finances, there's a whole lot that needs to be taken into consideration, but we have those discussions. But yeah, treatment plans are reviewed on a very regular basis at Changes. 6, many drug addicted individuals also have other mental disorders. And I did see that Dr. Tia did join us online as well. So not my area of expertise, but there's very, very few patients in our care that purely have addiction. Majority of our patients do struggle with other co-occurring disorders such as depression, bipolar, ADHD, personality disorders, etc. And when we wanting to treat the addiction effectively, it's very important that we acknowledge that and that we have that under management too. So the Dr. Tia and the medical team play a huge role in assisting with that. And again, Dr. Tia is part of our case management too, to ensure that that's under management. But we need to look at somebody holistically, and we can't ignore that aspect and just focus on the addiction. It's very, very important that we do acknowledge the co-occurring disorders. It's also important to note that there are sometimes some of these co-occurring disorders do complicate treatment quite often, and sometimes make it a lot more difficult for someone to get started. You know, if somebody is presenting with severe psychosis, for instance, you know, they can't get into treatment and start doing a lot of introspective work. We need to first get them stabilized. When somebody's struggling with severe depression, all of those things need to be taken into consideration before we can do, you know, any serious therapeutic introspective work.
And
so again,
if I may,
time is lost.
Roxanne, if I may add, so
Yeah.
I know that, you know, addiction can be a mask of an underlying mental illness. So for an example, schizophrenia, bipolar, major depression, and psychosis as well. So when someone stops using, those symptoms may surface, and especially during detox. So families need to be aware of that as well, because most of the time they'll be like, "Oh, my son was okay. Why is he not okay now? Why are you sending him to a psychiatric hospital?" Because the addiction was the mask of everything. Now it has been exposed. Now we can see that there's a co-occurring mental illness.
Very, very true. Yeah, thank you for that, Lindy. Number 7, treatment does not need to be voluntary to be effective, and we've spoken about it. Sometimes boundaries or enticements from family employment settings and of the criminal justice system can significantly increase treatment entry, retention rates, and the ultimate success of drug treatment interventions. With other words, just because your family member is saying, I'm not going into treatment, you also have a say. Absolutely, you can say, okay, well, who's going to pay your rent? Who's going to pay your bills? You know, you need to develop your bottom lines. And the same with continuous treatment. You know, if your loved one's saying, no, I'm not going to treatment. Okay, well, this is our bottom line. Before you come home, you need to do X amount of treatment before you can come home. Or if you're wanting to come home, you have to do outpatient. And we'll look at those different options earlier. But absolutely, you have a say. It's not just about your loved one. Okay, so treatment at Changes. We have a full spectrum of addiction treatment that we offer in various phases of treatment. We'd like to pride ourselves in the fact that we have high quality clinical care. We do like to involve the family just like we are this evening. And we have a variety of reintegration services, which we're going to touch on. Treatment is personalized to each patient, and I think we have spoken about that. And then those are just some of the treatment options: primary, secondary, tertiary treatment, and then the different outpatient options. I'm just kind of scanning over this because we're going to look at this in a lot more detail. So the first one over there on the left-hand side is the primary care. And I think that's the one that most people are familiar with. For most of our patients, that's where their walk with Changes starts, is at primary care. Often people move from primary care to secondary care. Secondary care is often referred to as the farm, and that is based in Reimsig. And the minimum treatment length there is 2 months. And I'm not going to unpack too much exactly what that entails because we're going to have a look at that in more detail. From there, people sometimes move to the halfway house. However, people can also move from primary care to halfway house. So sometimes the secondary care is skipped, but that does depend on, again, that individual assessment and what the treatment team feel might be in the best interest of your loved one. So the halfway house, what that is it's transitional living, and it allows for that reintegration to start happening. So one is living in a safe and secure environment, but can start working, can start studying, starts reintegrating back into society. Halfway house often runs concurrently with outpatient. We're going to look a little bit more at what that entails. Sometimes, again, somebody can't do halfway house and they'll go from primary care straight over into outpatient. Another option is that people sometimes do also go from primary care to aftercare. However, that's very, very seldom. We would prefer to go from primary care to outpatient first and then to aftercare, and I'll explain a little bit later why later. And then living recovery is right at the end. That one can only enter the living recovery program once they have been sober for 9 months. So these are the different phases of treatment that Changes offers. And again, the different options can be used to suit your loved one's needs. But I really want you to keep in mind that when the treatment team does make a recommendation, it's really a recommendation that we do believe that is in the best interest of your loved one. So if the treatment team, for instance, do recommend secondary care, there's a very, very good reason for that, as opposed to going straight from primary care to an outpatient facility. So yeah, let's just have a look a little bit at some of those. Primary care is one of those, again, that I'm just going to brush over. I don't want us to run out of time. Again, primary care is one of those that most of you are familiar with, I'm sure. So it's offered on an inpatient basis. Inpatient just means they sleep and they stay where they're receiving treatment. Most intensive phase of treatment, very much what Cheryl said, the ICU of treatment. One of the big things that happened there is the detox. We spoke about the detox. Our experienced medical team manages the detox process. The aim of the detox is to safely remove substances like alcohol and drugs from the body while managing the withdrawal symptoms. Once the patient's withdrawal has been medically managed and detox is complete, the focus then becomes on dismantling the denial. What does that mean? That means that we need to start narrowing the discrepancy between the patient's flawed perspective of their addiction and the reality of what it's actually like for them and their loved ones. So what we often say is it's important for them to come to the realization that addiction is the problem. So the problem is not because they have a horrible boss, or the problem is not because they went through a divorce, or although we take all of those into consideration and those need to be addressed in treatment, it's important to recognize that addiction is the problem. And then secondly, the severity of the addiction. So just how badly things got, how it impacted their social life, their work life, their financial life, their family life, their spiritual life, just all different areas of their life. So that's what it means to try and dismantle the denial. Okay, treatment includes individual counseling and therapy, 12-step treatment, group therapy, lectures, occupational therapy, consulting psychiatrists, and managing of the comorbidity. So while they're in primary care, we teach them about addiction, what is addiction, what does the disease of addiction look like, and they also get given certain tools to try and sustain their recovery, right? Again, patients' therapy and their program is individualized depending on their needs. And then just the last point, recovery is a lifelong process that doesn't end when the patient walks out the door. While in primary care, the therapeutic team help the patient make a custom plan for continued care. This could include secondary care, tertiary care, or some form of outpatient care. Okay, so long-term treatment. What is long-term treatment? Again, there's no one-size-fits-all approach to recovery. Treatment programs vary in terms of setting, the duration, and the intensity. For some, this might include long-term treatment. And again, long-term treatment is very much something that we do recommend based on the research and the fact that at least 90 days is needed for those relapse rates to significantly start dropping. Short-term residential treatment generally consists of 3 to 6 weeks, like our primary care program, but ideally, those short programs are followed by long-term residential or alternatively extended outpatient care. So the residential treatment would be like our secondary care or the farm, where again, it's inpatient. So they stay where they receive treatment, or the outpatient options where they get to work, study, go to school, live life while still receiving a form of treatment. And again, we'll unpack that in a bit more detail. This is because recovery takes time, and several weeks of treatment is often not sufficient for overcoming addiction. Long-term drug rehab usually involves at least 90 days in a residential treatment setting at minimum. Some rehab programs require or even encourage longer durations of stay. Research indicates that most addicted individuals need at least 3 months in residential treatment to significantly reduce or stop their drug use, and that the best outcomes occur with longer durations of treatment. The longer a person stays in treatment, the more they are likely to benefit and to learn. Okay, so the treatment needs vary from person to person, and factors that might influence the length of treatment. So some of the decisions or some of the factors that we take into consideration when we're making the decision includes the severity of one's addiction, the length of one's addiction, whether or not there's been previous treatment attempts and what the outcomes of those treatment attempts were, histories of relapse, co-occurring substance use and mental health disorders, and then as well as their individual progress and their response to treatment. So how are they interacting in groups? How are they interacting in lectures? How are they processing things in sessions? What is their behavior like outside of the therapeutic activities? All of those things get taken into consideration when we make these choices. Okay, benefits of long-term treatment. Increased chance of lasting abstinence. Again, that 90-day mark. If we have those 90 days, the chances severely increase. And then the longer one is in treatment, the more chances of success there are. It also gives you the time you need to reverse the impact of addiction. So earlier on, we spoke about the changes in the brain that takes place and how that takes, on average, a year just to kind of reset to baseline. So we need to give that time, right? And time takes time, unfortunately. And then it also helps to solidify recovery. I spoke earlier about all of this information that kind of gets thrown at your loved one, and all of these things and these tools that we are giving them, but it's important if they have the opportunities to try and apply that. And long-term treatment does exactly that. It promotes healthy lifestyle changes. Long-term residential rehab encourages and guides individuals as they make healthy lifestyle changes and develop healthier habits. Spending several months developing and practicing new habits in a structured, routine-oriented environment helps to ensure the changes an individual makes will stick once their time to leave treatment arrives. So routine and structure are paramount for us. We also have house rules that one needs to stick with and adhere to. And small things like that already helps for when your loved one leaves and they have a relapse prevention contract or sustainable recovery plan that they need to stick to. You know, again, boundaries, having boundaries with their peers, having boundaries with staff members, having boundaries with you as their loved ones over the phone. Being able to have healthy, sometimes difficult, but still healthy conversations about serious things. Having the opportunity for relationships to grow, for relationships to mend. You know, learning about exercise, learning about sleep hygiene, learning how to deal with emotions, learning coping mechanisms, and again, just being able to apply those things. Long-term treatment just really helps with those lifestyle changes.
And also, Roxanne, I know long-term treatment or continuing with treatment ensures that individuals do not feel abandoned after initial progress. So this would include planned strategies or prevention strategies, regular follow-ups with the counselors and sessions, aftercare, and the support system from the family to help them maintain gains and then cope with setbacks, and then also promote long-term wellness and independence.
Absolutely. Next one, fosters close, healthy relationship with peers in recovery. So if one hasn't been through addiction and addiction recovery, as much as we want to understand, it's difficult to completely understand. And in the rooms, we often say that addict to addict help is without parallel. And it's so important for one to foster those relationships with somebody who understands, who can support, who's been through something similar. And so often these relationships get built in longer term treatment, whether it's in the secondary care treatment or in a program such as outpatient and aftercare. Keeps out distractions. So life is hard. You know, having to deal with life on life's terms every single day, paying bills, cleaning the house, doing the laundry, feeding the animals, feeding the kids, dealing with my boss. And then I'm new at this recovery thing. I need to work on my recovery. I need to go to meetings. I need to go to treatment. There's just so much. And so often we feel that recovery then tends to take a bit of a back seat. So if one continues with long-term, in particular inpatient treatment, it helps to keep those distractions at bay a little bit. It helps just to solidify the recovery without those distractions. It doesn't mean that there's not stuff that needs attending to, because often there's legal matters and there's debt and there's a whole lot of stuff that still needs to be sorted out. But one can do that kind of in the safety of treatment and with the guidance of a therapeutic team, etc. So yeah, I think, sometimes those distractions just, yeah, it's difficult. It's difficult to balance that along with the recovery. Next one is it offers a high level of support. We spoke a little bit about the support that gets built in terms of the peer groups, but it's also the staff, the therapeutic team, and it's also about introducing your loved one to the fellowship, depending on which phase of treatment they are in. Just want to read the last line there that says, recovery is not a linear process. There are many ups and downs. Patients get to experience these ups and downs in a safe environment while learning new coping mechanisms and applying them in the said environment. And number 7 is one that Cheryl touched on earlier. The family has time to heal and work on themselves. Again, it hasn't just been 21 or 24 days that you have been going through a lot of trauma and through a lot of difficult times. It's also been coming for quite some time. And that takes time to heal too, and you need that time and you deserve that time. So with your loved one being in treatment, you can have the peace of mind that they're in a safe place, they're getting the necessary help, and you can actually focus on yourself and you can focus on your own healing process, which I think is so, so very, very important. Number 8, an essential part of long-term addiction treatment is the cultivation of a life rich in purpose and fulfillment. And Lindy, I don't know, but I'm sure you would agree with me that so many times when patients come into our care and we ask we do a biopsychosocial and we ask them, what are some of your hobbies? What are some of your interests? Some of the things that you like doing? Some of them will say, I don't actually know. I'm not sure. Or some of them will say, well, I used to like playing guitar, but I haven't played guitar in a long time. So yeah, it's also about just, helping them to find those things that they've lost again, or finding things that they enjoy doing. Yeah, and finding a life that's full and fulfilling for them.
It's very funny because today I did a lecture on redefining identity. Who am I without my addiction? So they were doing an activity around that.
Awesome. So number 9 allows for deeper understanding of one's addiction. Again, 21, 24 days. We do try and get that education across. Very short time for a lot of information that we do try and get across. Number 10 is skill development. So sustained recovery from addiction requires more than just abstaining from substances. It demands a comprehensive set of skills to navigate life's challenges without resorting to old habits. Long-term addiction treatment is an optimal environment for skill development, empowering individuals to build a robust toolkit for lasting recovery. So we refer to, there's a term in addiction and in recovery called white knuckling or dry drunk syndrome. And that is when somebody stops using or stops drinking, but nothing else in their life changes. And the theory around that is that, if we just stop using, but nothing else changes, we're still hanging around with the same people, we are still manipulating, we're still being dishonest, our relationships with our loved ones are still pretty broken, we're still resentful, that life's going to be really, really hard. And we're going to become severely depressed, and things are going to be so terrible that we're going to come to that place where we feel, oh, I might as well use. So, and I touched on it earlier, it's so important to not just take away the drugs and the alcohol or the process addictions, but to also give tools and to make lifestyle changes and to make changes in one's life with regards to the way we deal with things and relationships in our lives. So yeah, the skills development and making those changes and those lasting changes is another big benefit of long-term recovery. So as individuals progress through long-term treatment, they gain insights into the patterns of behavior that contribute to their addiction. Armed with this knowledge, they can develop healthier coping mechanisms and strategies for managing high-risk situations. So as they go through the program, they, more and more things kind of come to light. They were like, I always thought my mom and I had a good relationship, but the more I'm actually working on my relationship with my mom, the more I'm realizing that, maybe she was quite enabling, or, maybe I manipulated her quite a bit, whatever the case is. So the more one works on themselves, the more things come to light. As that says, the more they gain insight. So yeah, the more they're able to make growth and progress. Okay, so often there is resistance to long-term treatment. Even though evidence shows long-term treatment is what works, there is a lot of resistance from patients as well as families. One of the big things, and I think Cheryl touched on it earlier, is we often say people need to get back to work, they need to get back to school, they need to get back to their families. And it's been a difficult thing, and we kind of just want it to go away. We find out our loved one has a problem. We have sent them to primary care now, and the problem must be resolved, and we just want to continue with life. And we wish that it was so easy, but unfortunately it isn't. We need to keep in mind that addiction is similar to any chronic disease, such as heart disease or diabetes, in terms of the attention and perseverance needed to remain healthy. Instead of viewing treatment as a sacrifice, one needs to remember that the individual will gain more than what you lose. So we have a bit of a slogan that we say, whatever we put in front of your recovery, we will surely lose. So the way that I like to explain it often is it's like building a house, and recovery needs to be the foundation of that house. And everything we build needs to be built on this foundation. If someone doesn't have their recovery in place and this foundation strong, they can go back to work, but it's not going to be sustainable. Because they're going to relapse and they're going to end up losing the job. If their recovery isn't sustainable and we want to rush to get them back to their families, the family isn't going to last because they're going to relapse and there's going to be hurt and destruction in that family system. And that's why we say whatever we put in front of our recovery, we will surely lose. Recovery needs to come first. And if that is strong and if that is solid, everything we build on top of that, our career, our families, if all of that is in line with our recovery, then that will blossom and that will be strong. Okay, so long-term treatment at Changes is the secondary care, half-hour outpatient, aftercare, and the living recovery. So secondary care is the one that we refer to as the farm, which is a driven manner. It's a safe, structured, and caring environment where patients have the opportunity to process their addiction in depth. Also takes place on an inpatient basis. With other words, they stay on the farm while they're receiving treatment. The big thing about the secondary care is, again, the minimum treatment recommendation is 2 months, and that helps us to get to that critical 90-day mark. Again, the treatment is individualized. Once your loved one gets to the farm, we will do an assessment and we will see exactly what treatment needs to look like going forward. We also do have, again, it's the behaviors that need to be addressed. It's the solidifying of all of these coping mechanisms that they have learned. So counseling, group therapy, psychoeducation, lectures, creative interventions, animal therapy. A big one for us at the farm is family involvement. So we do allow for visitation to take place every 2 weeks, not like at primary care. Families get to visit every second Sunday. Helps to strengthen those relationships again. A lot of written work, written assignments, etc. And then around the clock care and supervision. Halfway house, I'm not going to read all of this because I do want to allow some time for questions. But again, the halfway house is a safe environment where your loved one gets to stay. But while they're staying there, they can return to work, they can return to studies, they can start going to meetings. So they start reintegrating back into society. As I mentioned earlier, often while they are there, they have the access to outpatient or to aftercare. They check in regularly, so we always know more or less where they're at. They have access to counseling, especially in times of vulnerability or crisis. And again, they have that connection with other people that are going through very similar situations than they do, or than what they are. Outpatient treatment. So outpatient treatment means that one can either be staying in the halfway house or staying at home. Again, you're busy reintegrating back into society, but you have treatment pretty much at night. So from 4:30 until 7 o'clock in the evenings, there is outpatient treatment that takes place. That takes place in the form of group therapy, lectures, topic discussions, things like that. And it also includes a weekly counseling session. There is testing if we feel the need for people to get tested. So again, it has that peer support. People are going through the same things. People are busy connecting with their families again, so they can say, you know what, I just had a massive fight with my mom today. You know, it's really difficult. And somebody else can relate and say, you know what, when I just got out, I had a massive fight with my mom, and this is how I dealt with it, and this is how I coped with it. So outpatient, and the same with aftercare, which I'll get to now, is very much dealing with the here and now stuff. I'm busy reintegrating. I'm busy starting to deal with life on life's terms, and this is what I'm experiencing. And the counselors and the support that one receives in the group sessions help with that. Aftercare treatment is a step down from outpatient. So where outpatient takes place in person at primary care every day of the week, aftercare takes place 3 days a week on Zoom for an hour from 5 to 6. So that's why I said sometimes we do have patients that are international patients. They've come from primary care and they need to return to somewhere else, and then aftercare is also recommended for them. But again, it's dealing with the here and now issues. This is what I'm experiencing now. This is what I'm struggling with now, and one gets the support for that. Living recovery, very similar, but as I mentioned, that takes place when one is 9 months into recovery. Okay, family involvement. Family involvement is absolutely important. And the ways that you can get involved as a family is to attend the weekly family support groups, little smiley face, that's what we're doing now. Engaging with your loved one, participating in discussions with regards to the continuation of care, setting boundaries, discussing bottom lines. It's also important to discuss with your loved one what you want and what you feel is important and what you feel is going to help. So yeah, in closing, before we make time for some questions, recovery treatment is a lengthy process. It takes time for both you and your loved one to heal. Please speak to your loved one's therapeutic team about what options are available and in the best interest of your loved one. Remember, you are a valuable component in this treatment process. Right. Yeah, do we have any questions? Lindy, unfortunately, I cannot see the chat room, so I don't know if there are any questions in the chat room.
Not yet.
Okay. Please, if anyone has any questions, or if anyone has had loved ones that have been through different phases of the program, and perhaps you want to share what your experiences have been like. So I think it's a very important question, because as much as I'm encouraging you as loved ones to have boundaries and bottom lines and to communicate that. I do think that perhaps you need to speak to your loved one's counselor and maybe discuss that with them. Maybe then you can discuss the content a bit better, which is difficult to do on this platform. So when the counselor has a bit more content, then they can perhaps advise whether it's something that needs to be done in a conjoint or in, on a call together, or, kind of what format that needs to be done in. So it's a little bit difficult to advise exactly how that needs to happen right now. So for now, my advice would be to perhaps speak directly to your loved one's counselor or therapeutic team, just to get their advice on how to deal with it.
Yeah, thanks, Roxanne. I think my rule of thumb is maybe we're on this platform for ourselves to learn about how we have to deal and navigate this lifelong journey with them as our loved ones, our children, our partners, husbands, wives, parents, etc. And I think we tend to want to rush. We want to rush them, and we want to have answers quickly, and we do tend to put some pressure on them. I call it pressure to perform. And sometimes they can't answer those questions for us. So if it's something directly pertaining to your loved one, definitely needs to speak to the therapist. If not, get some support for yourself, join a 12-step family support group, a tough love group. They can guide you. But time takes time. And, I think a lot of us, before they enter treatment, we're ready to walk away, cut them off, abandon, etc. And sometimes it changes afterwards, but slow down. Like Rome wasn't built in a day. And I think that's our urgency. I even see it in my own family. I'm very comfortable to let my one sibling who's in treatment now go at her own pace. My other sibling is like, when is she going to change? When are we going to get this? This must be this. Time takes time.
And I also think it depends on how the client is mentally, where they are mentally. So it's very important to discuss with their counselor before you can place those boundaries with them.
See, there's another comment in the chat. So I did manage to open the chat. I was just saying, thank you. My partner has just started at primary. This is helpful in understanding the process and the work we have ahead of us. So again, just really want to encourage you. If you have any more questions, please do speak to your loved ones, counselors, and therapeutic team.
And please keep coming back to this group. We cover different things each week, and we can't reiterate enough the importance of family recovery. The family's got to get better at the same time, because otherwise we're left stuck in the dark of almost a day that they went into treatment. And there's a saying, the addict uses, the family gets sick. So the addict is the one that's blessed and fortunate enough to go into treatment. That means we as family members need to do whatever we need to do to also get better. And as Tanya was saying, for us to reflect, I didn't even know that I had to work on myself. I thought it was quite simple. You put your loved one in rehab, they fix him up and send him home in a little box pretty with some rose-scented candles. Doesn't work that way.